Hey guys, I want to introduce you to Rocket.net. They are a super fast WordPress managed hosting provider who I use for my business and all my clients. In fact, Entrepreneurs Enigma's website runs on Rocket. Rocket is not only one of the fastest hosts out there for WordPress websites, they are extremely reliable, knowledgeable, and there for you when you need them. I've been in the WordPress web design world for more than 15 years. I've used a bunch of hosting providers in the past, but none have nearly been as good as Rocket, nor have they been reliable enough. I wouldn't trust my website to anyone else. We all know stuff happens online. Rocket has always had my back when I get stuck on something, and something happens with an update or something gets hacked. Rocket support is fast, and the reps are beyond fluent in the WordPress CMS, so they can solve the most complex issues quickly and effectively. So go check them out. Give them a shot. Go to gmedia.sh/rocket. That's gmedia.sh/rocket. Use the code ENIGMA. That's the ENIGMA, ENIGMA, at checkout and get 50% off the first 3 months of hosting. That's ENIGMA, ENIGMA, and get 50% off the first 3 months of hosting. Trust me, you'll be glad you moved to Rocket. I sure am.
You're listening to Entrepreneur's Enigma, a podcast about the ups and downs of the entrepreneurial journey. Every week, your host Seth Goldstein interviews entrepreneurs from all walks of life about their entrepreneurial journeys. From store owners to Fortune 500 CEOs, we all have stories to tell. So sit back and join us for the next 20 or so minutes while we explore the entrepreneurial world.
Hey everyone, welcome to another edition of the Entrepreneur's Enigma podcast. I am, as always, your host, Seth. Today I have Danielle Fette. I said it right?
Yeah, Fette. I said it wrong for the first year. I knew my husband, so we're all good.
Oh, that's great. Danielle is the co-founder and president of FetTech, LLC. She is a blue hen like I am, so go Blue Hens.
Yes.
Woo-hoo! Danielle is a visionary pioneer in the regenerative medicine space with more than 25 years of experience in the medical device industry as well. So kind of all over the place in the medical world there. As co-founder of FetTech LLC, she's built the company to accelerate the development of breakthrough healthcare solutions, ensuring patients receive better treatments faster. What I love about this is that she's not just trying to put a Band-Aid on it. She's trying to actually fix the damn thing.
Yeah.
And it's kind of nice because our health system in the US is very much like, put a Band-Aid on it and we'll figure it out later. And it's like, really? So anyhow, she's not just some person off the street who says, I'm going to do this. She has a nursing degree from University of Delaware. She's lived it. She has a background in nursing, biology, and chemistry. So she knows a thing or two here. I mean, so you probably should listen to her because she knows what she's talking about here. My God, the Philly came out in me just then. Wow. I mean, you're from the area, my area too. So you can kind of sympathize.
Yes.
FedTech has forged a powerful partnership with Wake Forest, the regenerative medicine hub in the U.S., and she lives down in Florida, so she gets the hurricanes and the nice winters and the unbearable summers. But how you doing, Danielle? How you doing today?
I'm great. You know, the summers aren't that unbearable. It's just a longer period of heat than what you're used to up north. And then when you guys are freezing.
Not this year. This year we were 80s we're 80s in November here.
Yeah.
Don't get me started on that.
No, I loved your intro. Thank you. I'm listening to you and I'm like, yeah, you know what? I'm not one that likes to complain just to complain. I'm like, if you're going to be bothered by something, then work to make a difference in it. Like change something about it.
Mm-hmm.
So when I was at Delaware and went to nursing school there, I really didn't love working in the hospitals for many reasons. And my hat goes off to the nurses that
oh my God,
can endure what they do every day for little pay.
Yeah.
Thank you, all the nurses out there. We appreciate you. We need you. We love you. But I saw healthcare broken in so many ways. And I always felt like I wanted to change it or make a difference, but I didn't know how until I got into the industry and saw the back end of how products are approved and why
Yeah.
they're used in the
Ooh,
hospital. And so now here we are making a difference.
you make a difference and you're brave because you work with your husband. We all
Yeah,
know who the boss is, but still, you
me.
still work. Yeah, but you work with your husband, which is tough. I mean, my wife kind of works with me in my business, but she kind of keeps the financials running. But like, it's tough because working with your spouse, how's that work in his entrepreneurial journey? Because you're both entrepreneurs and you're both in the same business being entrepreneurs. I mean, it's kind of
Yeah.
wild.
Well, I think it's because we have such a mutual bond and respect for each other. We didn't meet as husband and wife and then say, let's get a company and let's be
Yeah.
entrepreneurs. We met in industry, and Clay was the inventor and developer of all the
Mm.
medical devices that were getting cleared that my teams would then present in the field and educate the doctors on how to use. So
Oh.
together we would just brainstorm and think much bigger than the corporate America um,
Oh,
careers that
corporate
we had.
America can't get out of its way.
Yeah, no, it was really frustrating because there were so many layers of red tape, and at the end of the day, the board members care about what's going to drive immediately bottom line. They're not looking at 10, 20 years, really how to
Oh.
advance medicine. They want a quick exit, a quick stock,
Mm-hmm.
a quick buyout, those kind of things. And when I met Clay, I was like, you're the first person that gets me on so many levels as far as the products we're selling, how we can make them better, and how we
Yeah.
can help more people. And it came from a place of compassion, and really just we knew we had really good ideas. So I only say that because we started out as coworkers. He was actually
Yeah.
married, happily married, and I was happily single living in Fort Lauderdale. And we just became
Ooh.
friends, and it was a
Yeah.
mutual respect. He was the last person I ever thought I would date or marry, like ever, ever, ever. And it
Yeah.
just
Because he's a
so
coworker, and it
happened
just
that the
happened.
universe was like, you were meant to do good things together. So we ended up together. Um, but I would say we are the yin and yang together. We can run
Oh.
circles around most, like the two of us together.
You're a power couple. You won't say it, but you're a power couple.
We are, just because we really enhance the other person in a work environment. So, I
Yeah.
mean, personally, that's where it's hard working with your spouse, because you have to learn at the dinner table, like you can always talk about work, and we love what we do. So when you love what you do, you're always thinking and
And your
brainstorming.
daughters
But
are
like,
like, stop talking about work, guys.
yeah, like my oldest came over the other night for dinner, and Clay was excited to tell me about his day, and I was like, okay, Ariel is so bored right now. Like we need to talk about anything other than work. So that's where it gets challenging, is to put it away and focus on other things. I mean, I
Hmm.
always laugh, like if we didn't have dogs, or like our kids are out of diapers, so we can't talk about, when the last time they poop or ate was. We have dogs and we have work, and
Yeah.
finding that balance is really hard to put work
It
down.
is hard, absolutely. So how does all get to the entrepreneurial journey? Have you always been an entrepreneur, or have you kind of tried the nursing thing and say, oh no, 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 not for me?
I focused on wound and trauma nursing, but I knew I'm
Oof,
dyslexic and that I'm not good at attention to detail. I'm more of a big picture
yeah.
thinker. So for nurses, you have to be anal when it comes to documentation and
Especially for
following the
wound
rules.
care. Oh my God.
Uh, s-
You cannot not be anal. Wait, that's a
yeah,
double negative. What
you
you know what I
really
mean?
have to be
Yeah.
attention to detail, and I'm a more of a big picture thinker. And
Yeah.
also, I do have an entrepreneur spirit. I'm very, very
Yeah.
curious. I love diving headfirst into things. I don't like routine. Clocking in and out of a job doesn't provide me a sense of satisfaction and security. It makes me feel like I'm trapped and in jail, where other
I'm
people I can
bored.
respect
Yeah.
love
Yeah.
that, and
Yeah.
bored. So I knew early on, after working on the nursing floor, I'm like, this was not for me. I
Oh, but
got
so you
into
did try it though. So you did like say, all right,
I
not for
did
me.
rounds. I did in Delaware,
Oh,
actually, at AI
oh.
DuPont and some hospitals in Philly. I did some
Oh, so you
rounds with.
discovered it before you actually went. That was good. You kind of could tell like this is not where I want to do when I get out of this place.
Well, I knew I couldn't get into medical school because I can't take tests, and reading and writing is hard for me. And I went to a
Yeah.
professor at Delaware, actually, and I said, what am I going to do? I love medicine. I've always been fascinated with medicine. I can't take tests. So it's not like I can get a nurse practitioning degree or a medical
Yeah.
degree and then capitalize on that independence of running my own clinic or business.
Yeah.
What do I do? And he's like, you would be so good in sales. I'm like, okay, my life purpose is not to sell things. I mean, I can sell pretty well because I love educating and helping people in a
Yeah.
non-threatening way. I'm like, that's not my calling. He's like, no, no, no. There's actually jobs where you would educate on new products that the doctors just didn't learn about in medical school. I'm like, well, that sounds fun. I love educating. I love speaking to people, helping people.
You're an
And
extrovert. Yeah.
I'd still be a part of like cutting edge technology. I'm like, that sounds really glamorous. And I'm like, oh, and you make how much money? And you look cute and you go, we get to wine and dine people. And it just seemed like the total package. So I jumped into medical device and I was training surgeon on cutting edge, really innovative things like a pacemaker
Ooh.
that went into the brain, and the signals would change if someone had Parkinson's or tremors. Or
Oh, wow.
I did another device for seizures and depression. I mean, just really cool stuff that wasn't putting a Band-Aid on things, but through
No.
signaling through
It's
these
putting stuff in
devices.
people. We're going to take a quick break, hear from our sponsors, and get right back to the show.
Yeah, really cool stuff.
Yeah.
But I didn't mind the job, but I hated answering to upper management
Yeah.
because I knew I was always dispensable. No matter what I did or how much my passion was, I just felt like we were just a number at the end of the day. They were all of the decisions were made based on finances. And I hated
Mm-hmm.
that. It
Yeah.
drove me crazy. And then I stumbled upon wound care. So I would job topped every couple of years trying to find better, find
Yeah.
myself. And on the side, I did entrepreneurial stuff. So I
So
dabbled
you
in
got a
real
side
estate.
hustle. Yeah. Yeah.
Always had a side hustle because I was bored, with my
Love it.
jobs. My sister and I, at the boom of the internet, had an online clothing boutique, and we dabble with some TV stuff like styling celebrities, and had a physical location. So that was really fun, but that wasn't my life purpose is not helping ladies get dressed, even though I was very
I love it.
proud of how much we accomplished
Yeah.
so quickly with very little money. So that helped me entrepreneur wise, like figure out like how to do a website, how to market. Like I just learned a
Mhm.
lot of stuff through that
Learn by
experience
doing.
and
That's how you got to do it. Yeah.
networking, PR. So then I met my husband while I was doing my boutique. I was in wound care trauma, and this was at like the height of like not height. This was the very beginning of regenerative medicine being spoken
Yeah.
about in medicine, and stem cell. Like I remember going to Singapore for work in the hospitals. I'm like, wow, they're curing cancer with stem cells over here. Why aren't we doing this in America? I was
Because
just very
America's
fascinated.
backwards, but we'll stop it there. But America's backwards when it comes to this kind of stuff. So yeah.
I mean, we do trauma and ER care really well.
Yes.
Chronic disease and wellness, we are horrible.
Yeah.
So that's a whole nother podcast, right? I mean, I could talk all day long about wellness,
Hey.
but yeah, I was really fascinated with regenerative medicine. And regenerative medicine is basically using your body's own biology to signal to your body to heal and repair injury in an all
I love it.
natural way. So
Love it.
naturally,
Yeah.
we're able to signal to your body, hey, this is broken. Let's tell your body how to fix it, because our bodies are genius.
And
So
not just taking Advil.
right. So yeah, I can't stand there's a time and a place for medicine, but it shouldn't be the
Yeah.
first line of approach. And
Oh.
cutting into someone in surgery should not be the first line unless your appendix are rupturing. Like
Well, then
just one of my favorite.
you kind of should go in there and fix that sucker. Yeah. That's kind of
Yeah.
important.
Yeah.
That's
Yeah.
wild. That's wild. So you got into regenerative medicine with your now husband, and you've been rocking and rolling since. I mean, you have
I
what
know, no, we would
four
rock and roll.
brands?
We had a really interesting, unique journey because
Okay.
we believed in ourselves so much that we did not take outside funding
Oh wow,
to
that's
do this,
brave.
because we didn't want to answer to a board. I mean, when I say ugly
Exactly.
behaviors, I worked for companies that wanted to sell product that was that had bacteria in it that was bad.
Ew.
No, because they didn't want to throw away millions of dollars on the shelf, knowing that it could potentially harm a patient. So I was like, we will never answer to a board. We'll always dictate our own decisions.
Love it.
And a lot of that is because companies will often sell things that they know they can make a lot of revenue on. So what
Mhm.
if you have rare disease populations of small people, like not small, but like less people have this particular problem,
Yeah,
but
it's not as much
I
money
know I
there.
could
Yeah.
help them. A
Mhm.
company is not going to invest on a smaller population of people.
No,
And that
because
was really hard for
there's less
me.
money there. Yeah.
I'm like, this is someone's mom, someone's sister, someone's baby. Like, we need to help these people. So we didn't take outside funding. And I only say that because now, it's one thing to be like, oh, yeah, we're doing great. We're rocking and rolling. But it took 13 years to get here. And
You're a
there are times,
13-year overnight success. Yeah, that's what they always say. 13-year overnight success. It's like, yeah, we're not an overnight success. Yeah.
I mean, we're talking car was repoed. At one point, I'm like, do I like waitress or something so my kids can stay in private school? It was embarrassing. We put our house on foreclosure, always robbing Peter to pay Paul.
Oh,
But I
yeah.
wouldn't have had it any other way because now we have the independence to do whatever we want, whenever we want. Now everyone wants to throw us money, but I would take it.
It's ironic how that works. It's like when you don't need it, they throw it to you, and you're like, "We don't want it. We were good, thank you, but thank you for the compliment." But it's like, I could have used it back when my car's repoed. I like, gee, thanks.
Well, even if we could have gotten funding, we would have said no to the funding.
Yeah, yeah,
We
because you
thought
want to
about
because you didn't want to answer to a higher power working for someone. So asking a board, you wanted to. I see that you wanted to do it, your own way, and it's the way to do it is not to take outside funding.
Mhm.
The bootstrap. I mean, honestly, it's the bootstrapper's journey.
Yes. And we also didn't want to build a huge team because one of the problems I had found in corporate, there were so many personalities and hands in the pot that if you wanted to move things along fast, it was really hard. So even like a marketing piece had to go through legal, marketing, sales, upper management. I mean, it was back and forth, and it would take a year to get like a one piece of paper out to educate people. And I was like, this is was such a waste of time and effort. Like if I had to
Mhm.
sit in one more meeting in upper management, I wanted to cry where everyone's yesing each other and then they're going to happy hour bitching about it. I'm like, this is so unproductive. So we have a very, very lean team and we
Good.
outsource everything. And no other company does it like this. So we contract manufacturing, we contract our attorneys, we contract regulatory reimbursement. We have a
Hmm.
distribution sales team. So we're very staying in our lane. And what makes my
Yeah.
husband and I unique is we're able to invent products and get them FDA cleared, unlike no
Ooh,
other company. But there's a
like
lot of
that.
companies that can sell, and there's a lot of companies that can make product, but there's not a lot of companies that can invent products. So
Yeah.
we invent the products and then we partner with the people that are good at bringing them to the patients that need them.
Love it. Love it. So in your mind, and you kind of answered this, I mean, but what is the best thing about being an entrepreneur, especially now that you have the freedom to do what you want when you want and how you do it? I mean, I think I might have answered your question, but
Yeah, you did. It really is. It's that sense of freedom and satisfaction that when you believe in yourself and you're doing the right thing, you can see it through. And
yeah.
although there's a lot of stress, a lot of pressure that comes along with that, I wouldn't
Hmm.
have it any other way because I'm so proud of us. Like I feel so good. And even when you have moments where you screw up, which happen every day,
Everyone screws up. Yeah.
I'm really good at recovering from messing up and learning and pivoting and moving forward. So, and both my husband and I we're wise. We talk things through, but we move really quickly. We make mistakes, we pivot. And yeah, that freedom, that feeling like you don't have to answer to anyone and no one else controls what you do is
That's
the
nice.
best feeling ever.
I love it. Well, the only one that controls it is you. I mean,
Mhm.
let's make it perfectly clear. Clay answers to you, but still, he's
It
got a
depends. Like
boss now. I know.
he on the sales and marketing side, yeah, he comes to me
Yeah,
and or PR, social media, anything with
yeah,
regulatory, the law, getting it, the FDA,
that's
I
him.
answer to him. So it
Well,
it,
that's
it
good.
works.
It's tit for tat. You kind of know where your lane, and then how you say like where your lane is. You know
Mhm,
where your lane is. He knows where his lane is, and you both excel in your lanes.
mhm.
I love
Yeah,
it.
then that's this was like an evolution because I
Yeah,
was alone, single, independent entrepreneur for a long time, like 36 years until I met my husband. And I had to learn how to not relinquish control, but really trust his point of view.
share
Sometimes
control almost.
we
Yeah,
have ideas as humans and we want to express those ideas or we believe in them so deeply. And I've learned to pause and really, even if I agree or disagree, I want to hear his point of view. I'm like this with most people, but I really respect his point of view and I want to know the whys behind it because he comes from a different side of the business than I. And
yeah.
sometimes when you're not privy to what the other side of the business is doing, you don't understand the whys behind it. So I've actually really loved, I used to get so mad. I'm like, well, why can't you just change this thing so I can talk about it then in the field, with the doctors? And they'd be like, we can't. But if they would have explained why or the law
Yeah,
or we
the
can get in
why. Yeah,
trouble, it would have been a different situation.
absolutely. So on the flip side, what keeps you up at night?
Not being able to move fast enough to help all the people that need help. And
Oh, I love that. Yeah.
there's red tape getting into hospitals, having access based on money, reimbursement. And I I get hit up a lot, like nonstop that, my loved one has this wound or my loved one has this problem and you're my last hope and I'm begging and no one else will listen to me. And in my soul, like I really genuinely want to help everyone. But
But you
number
got the
one,
red
it is a
tape, yeah.
medical device. Like it's a
Yeah.
medical device. It's not a mascara. Even if I was the richest human on the planet,
Still have
legally, I
FDA. Yeah.
can't give this product out to everyone. And there's a process. It has to be driven by the doctor who wants it, has to be approved in the hospital. But also if we give everything away for free, which I would love to, we
Yeah, we
won't
all
have
would, yeah.
money to reinvest back
Yeah.
into the other projects that I know will help people, like inhaling our product to help with diseases that occur in the lung, or potentially injecting the heart muscle after a heart attack to prevent that the muscle from dying. Like there's a lot of ways we know we want to explore and prove our product works. And if I don't use our money wisely to reinvest, so there's
You'll
a
never be
fine
able to do
balance
it. Yeah.
between spending money and putting the money back into the company. And then
Yeah,
the
and
other
you have to
hardest
feed
thing is
yourself
like,
too. You have to feed yourself as well. You have kids, you have a husband, you have dogs. I mean, ultimately, yeah, I mean, you want to help everyone, but you have to help yourself too. So,
yeah. And the other thing, like I'm a
unfortunately, yeah.
very impatient ADHD. I want things yesterday. So
Oh,
when
same
I
here,
used
yeah.
to, I would get annoyed that it would take like 6 months to a year to get a hospital to approve a new product, right? On the
Yeah.
science world, these people start projects and it takes like 3 to 10 years to see them out.
Yeah.
Like that is great patience and like mental toughness. I don't know. Like
It's
I
crazy, yeah.
so I've had to learn how to be very patient when I'm so impatient.
You have to go for a walk. Like Clay's like, honey, go take a walk. Like literally, it's not gonna happen yesterday. Go take a walk. That's what my wife tells me all the time. She's like, if you need to just step away, just step away, take a deep breath. 'Cause I'm as ADD as it is. I'm ADHD as you can get, and it's like sometimes I want it done. I want the thing. I want it done, but the only way to get it done is to take the steps to get it done. And that's the kind of
Right.
thing. So
I
so
think also
yeah,
focusing on like the little small wins and gains, like the one foot in front of the other instead of the big picture. I've never run a marathon, so I hate long distance running, even though I did play lacrosse. But I have learned that if you celebrate the tiny little milestones moving forward, instead
yeah.
of like, I'm not satisfied because I haven't gotten to the end yet. So enjoying the
Mm,
ride is kind of my daily motto. Like, okay, what am I enjoying about the ride? Like focus on
mhm.
every single day. Like what are your minor goals in that day and have you accomplished them so I can feel satisfied?
Love it. So, what is the most important thing to carry with you all the time? You can go as woo woo as you want to get.
I mean, I'm pretty woo into like spirituality and stuff, but I think just feeling good.
Yeah.
My emotions are my guidance system, and I have learned that you can't muscle through things.
Mm.
My head's really strong and I want things yesterday, but if
You
something's
are the
not a
cross player. You are
yeah,
the
if
cross
some
player.
yeah, exactly. If things aren't a hell yes, it's a no for me. A maybe is not a yes. So I used to say yes or talk myself into business decisions, social
Mhm.
situations. But now I'm like, unless I feel really excited about the opportunity, whether it's to have dinner with someone or to make a business decision, if I'm not excited about it and I have any apprehension or hesitant, I don't make a decision and I do something else.
Love it. I love that. 'Cause it's so true. Because when you do a maybe, it always screws you in the end. It always does.
Well, our hearts and heads are really clever, and our
Yeah.
egos get in the way. And sometimes we know the answer. I can remember dating. How many of us have dated and you're like, well, on paper, this person is great, but your heart's telling you something else. And it's like trying to navigate that. That's why there's so many relationships that go south. You just
Yeah.
have to like really listen to how you feel initially and don't let your ego get in the way
Mm.
of steering you in the wrong direction. But for me, that's how I feel. If I'm nervous about something, I'm uneasy about something, or I'm not excited, I just pause and I wait to make a decision.
I love it. I love it. So Danielle, where's your social media watering hole? LinkedIn, I assume.
I'm on LinkedIn, Danielle Fette, Fette, and we have a couple companies. Our parent company is FetTech. So if you
Like
go to
it.
fettech.com, you'll be able to find all our other companies. So it sounds
Love it.
confusing, but
It
FetTech
isn't.
owns the
Yeah.
patent of the technology. And then from that technology, we
Push
invent
that.
different devices like an umbrella and we focus on different disease states. So same
Love it.
platform, the multiple tissue platform, but then we may have a powder for wound care. We may have a gel, for aesthetics. We're working on something for, inhalation. We have a viral company. So each therapeutic area has their own company.
So they all have their own lane. I like that.
Yep. And I'm on Instagram
Of
too.
course, we're all
Even though
on Instagram.
my kids make fun of me, and I explore TikTok. I'm really cool. I have like probably 50 followers, and I'm trying to figure out how to use it.
You're the marketer of the two of you. So there you go. You have to figure it out. There you go.
Yes, until my 12-year-old's like, Mom, that is not cool at all. Like no one's gonna listen to that.
I love
And they're
it.
so savvy with taking videos and posting stuff. Like I watch them, I'm like, God, that would have taken me a half an hour to figure out.
I don't even bother with TikTok, and I do digital marketing. I don't even bother with TikTok. I'm like, I'm too old. I'm too old. I can't do it.
I felt like that too, but I was more annoyed and curious. Like, I'm like, why can't I do this? Why is
Sit
it so hard?
down.
For
Well,
me?
yeah, determination. You're like, I'm gonna figure this damn thing out if it kills me.
Yeah,
Mhm. Awesome.
pretty much.
Danielle, thank you so much for coming on.
Thanks for
And
having me.
And we'll see everyone next week.
That was a great show. If you're enjoying Entrepreneur's Enigma, please consider giving us a review in the podcast directory of your choice. Every review helps us reach new listeners. If you like Entrepreneur's Enigma, consider the other shows on the Marketing Podcast Network at marketingpodcast.net.
Goldstein Media hopes you have enjoyed this episode.